You're listening to Just Medicine, an equity in healthcare podcast created by medical students in British Columbia.
Welcome back to the Just Medicine podcast. My name is Audria Semezi. I am a second-year medical student at the University of British Columbia, and I recently became involved with the Just Medicine podcast, so I'm super excited to have meaningful conversations about health equity. So now, my series of episodes will explore health equity in relation to vulnerable, marginalized, and underserved patient populations. As a medical student, our curriculum is filled with a plethora of topics, from heart disease to stroke to infectious diseases. And these topics are heavily represented in the curriculum, and rightfully so. But I found that issues surrounding the healthcare of vulnerable and marginalized groups are often not represented to the same degree. And I also feel that medical trainees who haven't had that direct experience working with vulnerable patients may not know much about the barriers that exist, as well as the importance of improving the healthcare provided to these patients. And this is precisely what motivated me to join this podcast and part of what motivates me in medicine to advocate for underserved and underrepresented patients. I am really looking forward to these discussions with different healthcare practitioners, medical trainees, and researchers. And I really see the value in learning about the barriers that exist for specific patient populations, what's being done to remediate these barriers, and what can be done by myself and other medical trainees to help eliminate these barriers. So, one of the major topics I want to focus on is the healthcare of migrant and refugee patients in Canada or British Columbia. As someone who moved to Canada from Nigeria at the age of 11, this is a topic that holds dear to my heart. I also believe it allows me to better see the perspective of patients, as I've also been a patient in an unfamiliar healthcare system that's hard to navigate and often filled with barriers. Literature does show that there are immense disparities in healthcare available to refugee patients, and this applies to various aspects of healthcare, such as primary, maternal, and perinatal care, as well as mental health care. Doing research on this area led me to the remarkable work of the Refugee Health Initiative, as well as our speaker for today's episode, who is Nikola Deretic, who is a third-year medical student at the University of British Columbia in Vancouver and the co-president of the Refugee Health Initiative. I think discussions about inequities are great for increasing awareness, but I think it's also deeply valuable to highlight organizations working to combat these inequities. So thank you so much for joining us today, Nikola. I'm so pleased to be speaking with you.
Thanks so much for having me. It's a pleasure.
So before diving into the Refugee Health Initiative, which I'm super excited to talk about, I just wanted to start by getting to know you a bit better. So can you tell us a little bit about what led you into medicine?
Yeah, for sure. So initially, like a lot of other students, I knew I liked science from an early age. I always excelled in those subjects, and that's why I pursued a science degree in university. But what really led me to medicine versus pursuing something else, another path from sciences, was my relationship with my grandfather. So my parents, when I was younger, worked very long hours, and my grandpa really did a lot of helping to raise me. And when I was in my undergrad, he ended up getting quite sick. He ended up spending several months in the hospital, and through that, I was in the hospital a lot with him. Got to meet a lot of doctors from a lot of different specialties that took care of his health. I was really amazed at how impactful they were to his health, and how they really just helped him through that really difficult experience. And I think that's what really pushed me towards medicine.
That's super inspiring. And I'm so sorry to hear about your grandfather and what you and your family went through at that time. And it's so beautiful to have people who have those stories that motivate them in medicine and who feel comfortable sharing with myself and other trainees. I think it's super inspiring and refreshing to learn about what brought us into this career. So thank you so much for sharing that. And I also love to ask about people's lives outside of medicine. So are there any activities you enjoy doing whenever you can find or create free time, I guess?
Certainly, yeah. And I think it's really important to have a life outside of medicine, no matter how busy it gets. So, for myself personally, love keeping active. I'm a huge fan of sports, especially basketball and hockey. Love following those sports and keeping active with them. Although, when it's a rainy day in Vancouver, I love building model kits, especially car model kits.
Oh my goodness. Have you always been into the model kits, like, or is this a new hobby that you got into?
This is a newer hobby I got into during COVID. I really wanted to just keep myself busy when I had to stay inside. I like working with my hands, so thought that was a really cool thing to get started, and I've just
Yeah.
continued with it through medicine.
Oh, that sounds super cool. And I also just love hearing people continuing things and not letting medicine be kind of the only aspect of their life. So it's definitely refreshing for me as a student just coming into it, to that reminder of finding things and keeping up with your other
Definitely.
identity. Yeah. Okay, so I guess we can dive in. So why don't we just start by talking about what the Refugee Health Initiative is? So if you want to describe the initiative and its mission. I know it's a big question, but yeah.
Definitely, yeah, would love to. So, the Refugee Health Initiative, or RHI, is a UBC medical student run initiative. So, it
Mhm.
aims to engage a few different groups, and this includes first off, refugee families in Greater Vancouver that were referred by a partner community organization, with a preference for families who have been here in Canada under a year. Second, we want to involve community interpreters with relevant lived experiences. Third, medical students. And fourth, community organizations and refugee resource centers. And there are two overarching goals of RHI. So, first, we help refugee families settle in their new communities by connecting them with a medical student and an interpreter who can connect the family to relevant resources, educational opportunities, and community services, and also maximize the use of the interim federal health benefit. Second, we want to help medical students become familiar with the availability and accessibility of community and government support for refugee resettlement to further their own communication, advocacy, and cultural competency skills by establishing a relationship with the refugee family and an interpreter.
Wow. That's honestly, when I read about the work that you've done, I was so inspired by it. Kind of touching on what I spoke about. I don't exactly have the experience of being a refugee, but I know what it's like to come in and be so unfamiliar. So having students who are there to kind of guide you through that process and explain different aspects of healthcare and kind of connect you to resources is super inspiring. First, I wanted to ask, what led you into this initiative? Was it something that you stumbled upon, or how did you find out, or like know that you wanted to be in this initiative?
Yeah, great question. So I've always been very interested in working with newcomers. So my
Hmm.
mom came to Canada as a refugee, and from an early age, I heard about the hardship she had faced with finding things like work and housing. And
Hmm.
furthermore, my own high school had a large number of refugee students. Over 60% of students at my high school spoke a second language.
Yeah.
And being surrounded by all these stories always made me wonder what I could do to help. So during my undergraduate degree, I volunteered with international organizations to help
Mhm.
Syrian refugees with applying to post secondary schools and improving their English language skills. And then
Mm.
after entering UBC Medical School and learning about RHI, I knew I had to join because it really spoke to me.
Wow. No, that honestly, I'm still so kind of in awe that an initiative like that exists, and it's, done by UBC medical students. So the next question I wanted to ask is, can you speak to what inspired the initial development? So I know we just talked about what led you into it, but are you aware of how the initiative started in the first place?
Sure, yeah. So RHI was created in response to Canada welcoming Syrian refugees
Hmm.
during their 2016 civil war. So since its inception, RHI has engaged families from over 10 countries. And
Wow.
over the last 8 years, we've had over 70 medical students here at UBC participate.
Wow. So, yeah, so you've touched on these are UBC medical students. So, who specifically are these UBC medical students? Are they just is it only medical students, first of all? Are there any physicians or other healthcare professionals in the initiative? And is this only in the Vancouver campus?
Yeah, definitely. So RHI is totally student driven and run, but we
Mm.
have contact with physicians. So, in particular, Dr. Videsh Kapoor is our faculty partner. She's a fantastic family physician.
Mhm.
She is very involved in global health, and Dr. Kapoor helps us with a variety of things, including connecting us with physicians working at refugee clinics and troubleshooting.
Yeah.
And in terms of the students that are involved with RHI, we have students both at the Vancouver and Fraser sites here at UBC.
Mm-hmm.
Many of our refugee families settle in the Fraser health area.
Oh, interesting.
And many of the students that join RHI join as first years. They're
Mm-hmm.
with RHI in their first couple years, working with the family. And then going forward, if they're interested, sometimes they join as execs and they're with RHI even longer.
Oh, okay. So students typically kind of have that one family and they maintain like a continued relationship with that family as long as they're part of the initiative.
Yes,
Oh,
definitely. So in
yeah.
the RHI partnerships, we have one or two medical students,
Mm-hmm.
and they're longitudinally paired with a resettled refugee family.
Mm-hmm.
And they do one or two home or virtual visits every single month for 2 years.
Wow.
So yeah, they work with them in this long-term kind of relationship.
Oh my, I think one of the best things that you can do for patients as someone who has been a patient, but also just learning in the past year is that longevity of the relationship. And
Certainly.
especially people who are just in this new country, in this new system, I think it's super important to have that familiarity. And it's amazing that that aspect is really emphasized in your initiative. And it's so much that there's so much to learn from your initiative about longevity and working with vulnerable patients. And so, you being the co-president of RHI, can you walk me through your specific role as a co-president?
Sure. So my role with RHI as co-president involves working with all of RHI's teams, and there's four currently. So there's the internal, external, outreach, and research teams,
Mm-hmm.
and I work to provide direction and help the team achieve our own collective goals. So I work closely with the other execs, and through regular communication, help them achieve our team objectives. And this can look like supporting the other execs with roadblocks that we might encounter, as well as being the first person they can turn to.
Oh, okay. Yeah. So that's a huge leadership role to take on. Was this kind of always the goal with getting involved with this initiative, wanting to kind of help to kind of lead it and help, improve or kind of reach its goals? Is that something you've always been interested in?
Certainly, I think the mission of the organization always spoke to me. I guess I didn't
Mhm.
know that I necessarily wanted to be co president, but I've always gravitated towards leadership positions.
Mm.
Being part of RHI in my first year,
Yeah.
I really loved the work the group did. And when that opportunity arose, I thought it was a good fit for me.
Oh, that's amazing. So in your first year working as part of the RHI, so you were placed with a refugee family as well, based on the description you kind of gave as a medical student. Is that correct?
Yeah, and working with a refugee family was fantastic.
Yeah.
It involved home and virtual visits,
Hmm.
depending on the family's comfort levels, and a lot
Yeah.
of different topics were covered.
Yeah.
I think the ultimate really goal of the pairing was empowerment,
Yeah.
and really helping the family, even after the pairing ends, with things like confidence,
Yeah.
that they can really, live here in a new community, and get by.
Yeah.
And some of the things that I helped my own family with, and other students helped their families with,
Mm.
included things like applying for jobs,
Mm.
navigating the transit system,
Yeah.
connecting with healthcare providers, scheduling medical appointments, as
Yeah.
well as accessing things like low cost dental care, culturally appropriate counseling, as well as housing resources.
Yeah, that's wow. It's really amazing that the initiative didn't specifically focus on on healthcare specifically. It kind of
Mhm.
spoke to that idea of like there's so many aspects of our life that are not directly healthcare, but they affect your health and your well-being. So finding
Definitely.
resources, jobs and dental care and the transit system, that all contributes to how the person is able to feel every day and how that family's well-being is. And it's so refreshing and it's quite educational to learn that these are how you can help support vulnerable patients. You support them in other aspects of their life that will ultimately contribute to the
Mhm.
betterment of their healthcare. So that's really such a huge thing for me to take in. And I even really liked how you talked about empowerment, and that's often not talked about in medical curriculum. So just also learning from like, your first year is really, it's really amazing how to empower patients. And I'm definitely taking in all of these lessons and like learning from this work because it's just so important. So
Thank
can
you.
you to the how the refugee families received working with medical students? How, like, even I guess in your personal experience, how was that? Did they feel comfortable? Was that trusting relationship? Did you feel that with the dynamic between the student and the family?
Definitely, yeah. And I think for some of the refugee families, coming to a new community can be really challenging. They're
Yeah,
already meeting so many new people, so many new faces. Can be difficult to know, who can be trustworthy and who can't. But I think how medical students do a really good job of connecting with these families and kind of earning their trust is relying on some of their strong communication skills, their professionalism, and especially their confidentiality. A lot of important things are shared,
yeah.
and private things are shared between the student and the family and the interpreter. And it's very important to ensure this confidentiality in terms of building that trust and that good relationship, so that the student and the family can keep meeting and working together over those 2 years.
Absolutely. So, so the families that the RHI works with are in the Vancouver Fraser area, correct?
Typically, yeah. So the referring organizations we currently work with are Mosaic and Diversity.
Okay.
And many of the families that they help connect us with usually settle in the Fraser area.
Okay. So how do the families learn about the RHI? How, like, do you know the process of how they're referred to this initiative, or like how do they get connected to you guys in the first place? Who tells them about it?
Yeah, great question. So we really try and have a strong relationship with the community organizations we work with.
Hmm.
So with both Mosaic and Diversity, we try to have regular communication with them, and understand what kinds of newcomers and refugees they're currently working with, depending on the year, what their needs are. And we have an intake form that these organizations can fill out when they feel that a family or an individual might require some extra help. So this extra help again might be things like finding a family doctor, but again it can be other things. Maybe that individual or family is struggling with finding housing, and that's where we can really help, because when they connect them with us, that medical student can then help them navigate finding some of those resources and spend a little bit extra time with them and help with some of their needs.
Okay. And so, as a medical student that's helping to kind of direct those resources to the family, how do you learn about these resources? Is this personal research, or does the initiative kind of provide kind of a base for them to access, like how to navigate the transit system and what, like, community organizations, if that makes sense? Like, how do you know how to help these families as a medical student?
Yeah, definitely. And I think there's two parts to that. So, first off, we do have a handbook, and we have an orientation, and both of these are helpful in really giving students a starting point. It has some of those resources in a lot of these areas and like an FAQ type page, where students can turn to, and kind of look at some of those initial things. But I think where RHI really shines is the individualization.
Mm,
We really try and cater to every single individual and family, because we know that their situations are specific. So that's where the medical students can spend some time doing research, looking things up, and trying to really find what specifically is helpful for that family or that individual, depending on their needs.
okay. Wow. Yeah, I'm just like taking all of that in. It's really, yeah, that's amazing. Like, it's nice that there is that guideline for students, but there's also that
Certainly.
emphasis on catering to patients' needs. And it's something that we all, as medical trainees, are hoping to learn how to provide the evidence-based care, quote unquote, slash the handbook, but also individualized based on the patient, because each patient faces different barriers and has different needs. So that's really cool that your initiative also integrates that aspect. I feel like so many things in your initiative can be applied to any aspect of healthcare, whether or not you're working with vulnerable or marginalized patients or
Mhm.
not. So that's really amazing to learn about. And so I was wondering if you could speak to the specific barriers that you have heard from the families you've worked with, or just kind of seen seen personally. I know it's we can't speak directly on behalf of refugee families, but I think what if there's anything you can teach us about these barriers that we could be aware of.
Yeah, for sure. And there are many barriers that refugees face, and too many to cover. But some of the ones I want to highlight are cultural and language differences. I
Mhm,
think this can make it really difficult for refugees to adapt to their new communities.
mhm,
Another one is socioeconomic challenges. I think we touched on those, but they pose many issues like finding permanent and appropriate housing. And of
right.
course, these have huge effects on health. And in terms of accessing medical care, health system factors, as well as patient provider relationships, especially as they relate to the biases some providers might hold, can also pose some very challenging barriers.
Yeah, I've read a lot about these barriers and even experienced them myself. And these
Mhm.
barriers also apply to non-refugee patients, like a lot of
Right.
marginalized patients, like migrant patients. So it's really, I think, again, there's just so much to learn about from hearing what these barriers are, because you can't help patients if you don't know the issues that are impacting their health. So I think it's such a vital thing for all medical trainees to learn about. Is like you never know when you're going to encounter a patient who's from a vulnerable
Mhm.
population, and we all want to be equipped to give the best care possible. So thank you so much for sharing these barriers and like educating us on that. I For language specific barriers, I was wondering if your initiative ever encounters these language barriers when working with families. Do you work with families who speak a different language? And do you have language interpretation services?
Yeah, and certainly almost all of our families are not fluent in English,
Okay.
and they do often have interpreters as part of all our pairings.
Hmm.
Some of the most common languages we encounter include Arabic, Farsi, Dari, Tigrinya, and often that interpreter is really critical in helping communicate between the medical student and the family. And it's
Yeah.
also great learning for medical students to get that experience working with an interpreter early on in their medical training, in their first 2 years before they encounter individuals during their clinical rotations in third year or in their clinical experiences in fourth year, working with individuals that might be hospitalized that might not speak English, and
Right.
they have to use an interpretation service. So, getting that experience can be really valuable for medical students.
Absolutely. I definitely agree. It's really important before you kind of are faced with real life being in the wards
Mhm.
all every day to know how language affects different patients and how to get the resources you need in order to care for a patient. So, knowing the resources for language interpretation services or your hospital or clinic's protocol for that is super important. And it's amazing that the students in the RHI are getting that exposure to it. And I think even you just sharing that with us makes myself and any listeners more aware of it, which ultimately will make us better clerks and better physicians in the future, hopefully. So, thank you for sharing that.
Definitely.
So we talked a bit about the longevity of the relationship with the refugee families as well as the medical students. How else do you help patients like feel continually supported even past the period? Because you talked about 1 to 2 years typically of working with the patient. So, how else can do you support those patients? Because I know you talked about empowerment. So, does
Mhm.
empowerment kind of mean giving them resources that they can continuously access in the future? Yeah, if you could speak on that.
Sure, yeah. And most of our pairings are 2 years.
Okay.
And over those 2 years, we do try and address the needs of the families,
Hmm.
whatever those might be in terms of like accessing resources.
Yeah.
But in terms of the empowerment piece, we also try and help the families get the confidence that, even if things come up in terms of wanting to, let's say, find a community center for something specific, that they feel they have the confidence to find that resource on their own,
Right.
even in the future. But there
Yeah.
are cases where a family really still feels like they need support even past the 2 years.
Hmm.
And on a case by case basis, if we have the capacity, we'll
Yeah.
try and repair with a new medical student. And
Okay.
potentially keep the same interpreter if we can, so that way they can continue receiving support and they can be matched with a new first year medical student that can keep helping them out.
Oh, wow. I really like that you kind of have that aspect in place, because yeah, you just
Mm-hmm.
really thought about that. What if something happens, or they feel that they need the support again, or they need to reach out
Right.
to you guys, and having that included in your initiative, it feels like you guys really have thought of everything and really have worked with, that's, it's like kind of like the importance of like knowing the needs of your patients rather than what we think their needs are. So it definitely sounds like the initiative has included the words and the experiences and perspectives of refugee patients and integrated them into creating something that actually serves them, and that's really, and a lot of the research I read was a lot of the more impactful ones were the ones that directly interviewed or shared the experience of the patients themselves, because they know what they need best, and
Right.
they know the priorities of their needs and what are the biggest barriers they face when they come to a new country. So it's
Yeah.
nice that that translates directly in your initiative. And
Yeah.
again, just so much to learn and to apply to every aspect of medicine, and really just kind of in life, and learning the needs of people around you, and having plans in place for when things don't go according to the typical plan. So people often need more help. It's not always the 2 years. So it's nice to learn about that.
Definitely.
So working directly with a vulnerable population, even just learning from school, there is a lot of cultural sensitivity that you need to integrate when doing work for a specific patient population. So, how do you yourself or your entire initiative ensure that your work is as culturally sensitive as possible, as well as responsive to the diverse needs of the patients? I know you touched a lot on the individuality, but if you could just speak more to the cultural sensitivity training or aspects of the initiative.
Yeah. So this is something we are certainly always working towards and learning more about. Certainly not experts on the topic,
Hmm.
but what we try and do on intake is get as much information as possible from our referring organizations. So like Mosaic and Diversity.
Hmm.
And I think that individualization piece, I think that's one part of it. We definitely try and have every student really personalize the approach they take to working with the refugee family. And I think that's a big part of the sensitivity, as it really gives them a chance to look into the specific needs of the family so they
Hmm.
can best support them. So we really prioritize pairing interpreters with refugee families from a similar cultural background as well. And this further helps build a strong relationship between that trio of the student, the family, and the interpreter. And in terms of the skills and the training, we rely on many of the skills in the communication skills lectures that are
Hmm.
part of the UBC curriculum in first year. Those are excellent. But we also hold our own RHI trainings that really re emphasize those communication skills that students learn. So, again, those things like professionalism, confidentiality, and excellent interpersonal communication, they keep coming up again. And
Yeah,
they're just so important when working really with anybody.
yeah,
And we found that taking the time to actively listen and empathize while keeping all the information shared confidential goes a really long way in building that trust with families and being able to meet their needs.
yeah. Thank you so much for sharing that. The idea of empathy and confidentiality always like has come up in medicine, and I feel like that's always what patients feel that allows them to trust their physicians the best,
Yeah.
that knowing your physician or who you're working with is a human being who can take the time and understand or try to understand your perspective and what you need. So it's really important that your initiative integrates that, but it's also important for anyone who's learning about the initiative to know that is how you can, those are steps you can take to be sensitive to any type of patient.
Right.
And kind of going along with that, are any other specific values, ideas, perspectives, or skills you want to share with myself and other medical students? Kind of advice on how to be more culturally sensitive or sensitive in general as you kind of as we go through our career in medicine.
Yeah, so I think really just listening to the patient or listening to the person you're working with. I think that's really just so key. They're telling you like what they want you to help them with. So just listening closely, being really attentive, and trying to, just not have like a frame, or not just have a same approach for everybody, I guess, but
Yeah.
maybe having a general way of going about things, but really, individualizing your approach, while really understanding their concerns. I think I found that's really key.
Right. So, can you also share any insights in general that you've learned from your experience, both as a co president, but also working with refugee families that really stand out to you?
Yeah, for sure. So I think that understanding that, all these people, that are referred to us, all these individuals that are newcomers or refugees, and all these families, they come with their own traumas. They come with their own life experiences and stories. And of course, again, coming to a new place has its own barriers. So just being mindful of that, I think, is really, really important, and understanding that. And
Mm.
again, just individualizing that approach to the families is really important.
And you touched a little bit on the trauma. I'm not sure if trauma informed care is also something that's integrated into the initiative or kind of the work you do, because it's a kind of a big topic that we've learned about in our medical curriculum and will always learn about in medicine and really all aspects of healthcare. So is that also kind of integrated into the initiative as well?
Yeah, so we try and go back to those strong communication skills, and
Mm.
that we learn through our medical school curriculum, and kind of reemphasize that. That's a big part of it, and just having the students really, look some of these things up, in terms of the individual that they're working with, or the individual family that they're working with, and then kind of researching more into that. I think that goes a long way.
And I kind of wanted to veer a little bit off of the initiative specifically because this is a lot of important and impactful work, but it can be deeply personal, and I can imagine can affect the students working in the initiative in many different ways. So I was wondering how you practice self care and balance being a medical student, but also in such an important initiative. How do you balance all of these roles and different aspects of your life while maintaining your own well-being?
Sure. And I think that goes back to some of those hobbies outside of medicine and having them. For me, if I can get out, sports is something I really enjoy. I love being active. I
Yeah.
think that really helps me. But when the weather is bad, when it's winter or rainy or whatever it is, I think, doing something with my hands, for me, is my mindfulness, building those model kits. That's really important.
Yeah, I can imagine the rain thing comes up a lot in Vancouver, so it's good you
For
have
sure.
plans for either or. Yeah, so I guess we can kind of go back into talking a bit more about the RHI. So I also saw, like, looking through your website, which is beautifully done also, by the way, a lot of
Oh,
very
thank you.
informative and really impactful, even just learning about it objectively is there's workshops and research projects that kind of featured on the website. So I was wondering if you could tell us more about this, the research projects, or just kind of the workshops that RHI students are involved in or developing.
Yeah, I would love to. And our workshops are really important. They were implemented to encourage health literacy among refugees. So, medical students create and deliver presentations on a variety of health related topics with the help of interpreters at community refugee resource centers. And some of these topics we've identified as really helpful, with collaboration with these organizations and some of the refugee families we work with, include things like mental health, healthy aging, preventative medicine, reproductive health, as well as an introduction to the Canadian healthcare system. And since 2022, we've actually had 24 presentations on 9 different topics. And some of those really big languages that come up in terms of interpretation are Farsi, Dari, Tigrinya, and Pashto. And for research, we have some current studies, including examining the family-student pairings on the impact of medical student training, as well as evaluating the impact of the workshops on refugee health literacy. We have a plan to start a new project as well that will look more closely at the barriers that refugees face when trying to access primary care. And a completed project we have is looking at a strengths based inquiry of the resiliency factors among refugees in Metro Vancouver.
Wow, that's really amazing. I really love that you also integrate the research aspect of it
Mhm.
because I don't even know where, I think I was listening to a podcast or something, but um, some like they talked about a lot of health equity issues, and they're often underlooked. Oh, sorry, yeah, they're not often underrepresented and kind of not talked about because of the lack of evidence and research in it. The best way to get anyone to listen, apparently, in medicine is by having research done in it. So it's really amazing that you're also working to provide the research that is needed to improve the um, inf- to kind of improve the awareness of these issues and kind of give that evidence-backed information like this is an important issue. These are patients who face real barriers and there is evidence backing it, and there's students who are working with these families and involved in this research as well. So I really love that aspect. And I also love that there's so many different avenues of advocacy in the initiative. So there's the presentations, and there's working directly with families, there's the leadership roles, there's the research, there's so many different roles to be played, and it speaks to the different roles that are needed to make a
Mhm.
change for people. We need leaders like yourself, we need people who are speaking and giving presentations on
Mhm.
different aspects of healthcare, which also, by the way, that you touched on areas in healthcare that are um, often, I would say, poorer outcomes for refugee
Mhm.
patients. So you talk about the mental health care and the
Right.
primary health. So it just is just showing a lot of how comprehensive the initiative is. So I'm really just moved by the different hats that students play. And I see not only how that's deeply beneficial for the families you work with, but also for students. It develops who they are as people, I can imagine, and the different ways they're able to help people. So that's amazing. And even just giving students opportunities to make an impact in healthcare, like outside of the classroom, especially in the first 2 years. You're not deep in the physical aspects of healthcare. You're not working directly with patients all the time. So
Right.
making an impact in it is super impactful. Um, and kind of speaking on that, all the roles that you're doing, are there any goals or ideas of expanding the RHI? Because I know you guys are based in Vancouver and you're hogging all
You're right.
these amazing opportunities. But what about you? I don't think I mentioned that again, but I'm in the Island Medical Program, so I'm in Victoria, and I would it would be amazing to be involved in this. And not, obviously, there's so much that I'm sure would go into that, but I was just wondering if that is ever the next decade or however long it takes to kind of expand to other sites or different places in BC.
Yeah, definitely. And it's funny you asked that. I think the reason we're mostly based here is because a lot of the resettlement organizations are in
Mhm.
the Greater Vancouver area. But
Yeah,
interestingly, I know you mentioned the island. We've had some initial conversations about potentially expanding to the island. And honestly, we would love to expand to all of UBC sites, including to Kelowna and Prince George, if we could find
yeah,
organizations to work with there and help connect us with refugee individuals and families. We would love to do that. And that's something that's definitely kind of on our minds, trying to expand the program to other settings. Both within UBC, but also at other institutions, if the opportunity arose, we would love to try and expand our initiative. And another thing on our horizon, is something we notice is that refugee health education should really come early in the medical student training.
yeah,
And the RHI is an extracurricular opportunity, and we have limited spots. And students that do get that exposure really find it valuable. But due to capacity limits, we can only connect so many students. We can't connect every single student at UBC.
yeah,
So another thing that we are working on is trying to connect with faculty to integrate more things like experience with spoken language interpreters, as
Mhm.
well as more background and critical thinking on the barriers refugees face for all medical students. So even if students can't necessarily get involved with RHI, that all students have some more of this training before they enter their clinical rotations later on in medical school.
Oh, wow. That would honestly be super amazing. Just to have even just a little bit of kind of a little way to better work with
Totally.
patients. And even if we can't directly be involved in the RHI, I think it's amazing that you're working on different ways that students can just be better medical trainees for refugee patient populations or other marginalized patient populations. So there's that aspect. I was also going to follow up and say, is there any other ways you think, if you were to tell me as a medical trainee, how I can support um, refugee patient populations during my training that I know is not directly with the RHI, but I don't know if there's any ways you think can just things to be mindful of or things we can get involved in.
Yeah, for sure. That's a great question. Well, of course, joining RHI is the best option. A little bit biased there, but otherwise, just being excited about all the opportunities that present themselves is huge. So
Yeah.
students can find working with an interpreter or an interpretation service intimidating, and sometimes they shy away from these opportunities. So, if students do find themselves in a hospital or a clinic where they can work with an interpreter, they should absolutely take that opportunity. It can really make a difference in understanding the patient's stories and concerns if you use an interpreter. And additionally, reading up on challenges that refugees and newcomers face in your own spare time can be very helpful. It can help you empathize with the struggles that a patient is facing if you know some of the hardships that refugees endure.
Yeah, I definitely think that's something I want to look into as I kind of start my second year and as I go through, because I think it's so important to me, and I'm sure there's so many other students who want to help patients outside of the classroom, and we don't want to have to wait till we have our full license to do that. And I think it's nice there's
Yeah,
initiatives that are here to allow us to start making an impact, because I think the patients the betterment of the patients shouldn't have to depend on your training level. I think anything you can do is so important to do. Even just spreading awareness, which is why I was so excited to have this conversation, is huge. And I want to learn myself how I can help patients, and I want others who want to know how to do that as well. I want them to have that opportunity. So thank you again for coming. I know I keep
thank you for
thank you.
inviting me.
Yeah, it's really no, it's really great. And I know, as a medical student, you're super busy and there's so many hats you have to wear, but it's nice that you are taking the time to kind of help support other trainees as well. And there's so much to learn from each other. Like, it's not always our educators and the physicians. Like, those are quite amazing resources to have, but there's so much we can learn from each other. There's so many interests we all have, different things that motivate us. And I think
Definitely.
we will all be better physicians by learning from each other. So thank you so much.
Definitely.
I think we're kind of wrapping up, but I just wanted to know if there's anything else you wanted to kind of share about the RHI or your work in general.
Yes. So I would recommend to any medical students listening at UBC's Vancouver Fraser programs to apply to RHI. It's a fantastic opportunity, truly, to gain unique memories and experiences. But additionally, we are always open to collaboration. So if you are a medical student at a different UBC site or at another institution, we're always happy to collaborate, hear ideas, and to expand the RHI model.
And then I just want to ask your work in the RHI, both as co president and also working with families, do you think that that's already made you a better medical trainee, or has it kind of informed who you are in medicine? Like, has that contributed in any way to who you are?
Yeah, and I've even seen it directly. I'm just finished the first week of my own clerkship here in third year, and I encountered an individual that had troubles with English and had a second language. So having some of that familiarity, working with an interpreter was very helpful for me in working with that patient and made me a lot more comfortable. And I don't think I would be as comfortable if I hadn't worked with an interpreter before.
First of all, congrats on starting clerkship. That is
Thank
amazing. And
you.
we are sending you so much peace of mind and excellence and every good thing. And thank you also for sharing that story. And it's nice to know that the things you learn in these roles translate into real life. And it just kind of shows the importance of education and just having that experience. You know, you're always better off if you encounter different types of patients and you kind of open yourself to
Yeah.
those opportunities, just like you said, being excited to work with patients and being excited to jump in and not shying away because you don't have experience with refugee patients or any other patients.
Sure.
So it's definitely something that I want to integrate into any aspect of my medical education. You know, it's always frightening. I feel like everything in medicine is scary until you have experience in it.
Yep.
So it's nice to hear that and that to know that it makes even makes even the slightest bit of difference in your first week of clerkship. So I can only imagine like how that will continue to translate as well. So yeah, thank you so much, Nicola, for joining us and sharing your
Thank you for
insights.
having me.
I know I learned so much from you and feel so inspired and refreshed in, medicine and what I want to do. And it's so nice to hear about initiatives that are working to help patients and advocating for patients, speaking for those who are underrepresented. Of course, this isn't specifically an educational format, but it's just about creating awareness and having conversations that can impact myself and other students. If that even makes a sliver of a difference in a patient's life, I think it's worth it. So I hope you enjoy the rest of your day.
You too. Thank you so
Okay,
much.
take care.
Thanks for tuning in to Just Medicine.